Welcome to my first live stream for 2025. And it is an honor to be able to address the so many questions that came in. And so with that, it's obvious that I'm not going to be able to answer the over 300 questions, but many of the answers that you're looking for do exist, and they exist on our website and they exist on our YouTube channel. And so I strongly encourage you just to do a simple search. If your answer doesn't get addressed today, it's most likely because I already have an answer up there for you. So all you have to do in a Google search is put in Milia Guide and the topic that you're looking for answers on, be it a weighted vest, be it yoga, cancer, activities of daily living, sleep. So these are all topics that great questions came in, but you will find the answer for. So I will try to go through today's live stream based on priority of questions, and being a physical therapist, my expertise is in exercise, and that's where I'm going to start. So the very first question is, can exercise help improve bone strength and minimize fractures? And I love this question because so many of us are focused on our DEXA scores. And although lifting heavy can improve DEXA scores, lifting even at a lighter weight can improve bone quality. It's just unfortunate that we don't have easy measurements for bone quality that you'll have access to. But there was a great study done, and the study continued with this group in Germany for over 10 years, the Erlangen study, and they had individuals lifting more in the range that I recommend, 8 to 10 repetitions, where they were building over time. And the beautiful thing about that study is nobody got injured, but everybody reduced their fracture risk. So when they compared the exercise group to the control group, they had far fewer fractures. And so one of the really important things with exercise is whatever you choose to do, it has to be sustainable. So always think, am I going to be able to do this or want to do this or afford to do this in a year, in 5 years? Because the journey to building bone is a lifetime when it comes to exercise and movement. Okay, I need to take a breath. I always feel like I am talking to all of you. So again, thank you for joining me. Okay, how to handle training schedules when you're on vacation and weekends. Try to make your plans include movement. So it doesn't have to always be formal exercise, but just make a point of, okay, I'm going to park that much further. I'm going to get a brisk walk in to visit or to go to a restaurant or go to whatever you're doing. There's always usually opportunities to take stairs. And then there's always devices and places to do a plank, to do a push-up off of, to do your back strengthening on your journey to and from. There's so many exercises you could do just pushing into the seat that you're sitting in. So just think about incorporating more movement into your life. And then there's also the video that I created on exercise bands, which is specifically on providing you with an option to exercise with bands when traveling. Okay, next, which osteoporosis exercises are beneficial if done every day versus those done 2 to 3 times a week? So with osteoporosis, we're always looking at strength training, weight bearing, balance, safe flexibility. So things that can be done daily are your balance exercises. Actually, it's really great to do them daily because then you don't have to do very many minutes of it. and you're just continuously building on your balance. That's another easy one when traveling, by the way. And flexibility. So flexibility, the body allows you to do it anywhere, anytime, however much. Recognizing that flexibility exercises do not build bone, but it gives you the flexibility, your body's ability to move with more ease and with usually less stress on your spine. The ones that you should only do several times a week, 2 to 3 times a week, although you could do strength training every day, is the strength training. But in regards to 2 to 3 times a week, if you're doing the same program, then you can repeat it 2 to 3 times a week. You don't want to repeat the same strength training exercise on a daily basis because the muscle needs recovery time. The other one I should mention in terms of weight bearing, brisk walking, running, jumping, these kind of things, those can also be done on a daily basis. And best exercises to prevent osteoporosis in the hip are weight-bearing exercises. Doesn't mean you're holding weights, although you can be, but it's your body weight. So again, if you just do a search on Mealer Guide weight-bearing, you will come up with lots of information. Okay, safe exercises. Some people are asking, particularly, and I wanted to address these, is it safe to lift free weights? You know, if the weights, arms are down straight and you're lifting arms to shoulder height, either a single arm or double arm, I would say no, and not because of the direct impact from that exercise, but rather the effect that that exercise has on the disc, and therefore the pressure that's created in the disc on weaker bone can cause or lead to biconcave fractures of the spine. So it's the second most common type. But also when choosing exercises, and the other exercise was taking the weight from the hip and going across. I always wonder, why would you even choose that exercise? Functionally in life, you don't want to be doing that move. It's not a wise move biomechanically. And so I tend to err on the side of caution when prescribing exercises. Is side bending, side to side, contraindicated? So with weights, it is contraindicated. It has been shown to be very compressive on the spine. Without weights, less problematic, but it is, again, in my opinion, not a wise choice, because you're always looking to elongate. We do so much compressing as it is, so you're trying to elongate your body, and therefore you can do the last stretch that's in the stretching section of Exercise for Better Bones, which basically you're elongating. So I'm kind of demonstrating the stretch in standing right now. But you could also, in the book, it's done lying on your back. So it's not compressive whatsoever on the spine. Next question. With osteoporosis, is it risky to lie on my chest, over my ribs? Is there a chance of a fracture? So this is specifically, I think they're asking in regards to the exercise that is very, very critical for strengthening your spine. And in the book, it's called the Floor M exercise. So you're lying on your tummy and then lifting your spine, not the legs, but just the spine and head and arms. And so placing a pillow predominantly under the pelvis, but going all the way up to your breasts. This exercise has been used since the 80s and shown to be safe with individuals with low T-scores, osteoporosis, they already had compression fractures. And so It is safe to do. I just say find the right pillow that feels comfortable for you. If, however, you have a history of fracturing ribs, then obviously it might be contraindicated for you. Is the bridge or hip raise, lying on your back, safe for the thoracic spine? It is an exercise that myself and many physical therapists do prescribe with individuals or for individuals with osteoporosis and osteopenia. It is a very good glute exercise. It's also an essential exercise if ever you're hospitalized and need to use a bedpan. But a really important thing in terms of protecting the thoracic spine is not doing the exercise kind of in a rounded position where the pressure's on your spine, but rather ensuring that you turn your palms, and these are all written instructions in my book or in the videos, I say it all the time. Palms are turned to the sky, and you're tucking your shoulder blades so that when you lift your hips, the weight is being transferred into your shoulder blades. Now, if you're very thoracic, your thoracic spine is very kyphotic, and you cannot get that, and you feel when you're lifting that the weight is predominantly going through your spine, then I would limit the height that you go and really focus on the glute squeeze part. And you can also do the alternating prone leg lift, which is a great alternative that is also in my book. Should somebody with osteoporosis of the spine do a dumbbell seated overhead press? I recently did a YouTube video on exercises to avoid. That was one of them, mainly because it was in a seated position. So she asked, what is a good alternative? Is to do it in standing. Because doing any exercise, just the fact that you're in a seated position puts a lot more pressure on the spine in a negative way. So can you still build bone when not lifting heavy weights? And then how heavy do you have to lift? So yes, you can still build bone, but as I say, it's often not detected on a DEXA. So it builds more the quality of the bone. But the really important thing about strength training, because the marginal gains in terms of strength training, very tiny in terms of building bone. But more importantly, it gives you the strength that you need to protect your bones and to protect yourself and catch yourself from falls. It also, especially when strengthening your spine, gives you the ability to move in safe ways. Because most people are worried about fracturing, and the two most common ways you're going to fracture is a fall or repeated poor movements. And it's usually kyphotic movements or kyphotic or bending and twisting. And that's largely because of weakness in the paraspinal muscles and tightness in the front muscles of the chest wall. Okay. And this comment, and I do want to address it because we do use FRAX to help you determine the correct exercise level within Exercise for Better Bones. And they said, my doctor says that we don't calculate FRAX scores when we already have a high fracture risk. And that is true, that there is recommendation that if you're already, if your spine scores are below -2.5, that the FRAX score is less important. But FRAX, being fracture risk assessment, asks a lot of important questions that give us information on the quality of the bone. And we don't have that information otherwise. And when you're following my program, I never get to see you. And so I want you to have some guidance in terms of not just your bone density, but also your bone quality when choosing the right exercise program. So that's why we integrate FRAX. Also, if you want to know how to fill it out correctly, you can also just look, and I have a 20-minute tutorial on how to complete the fracks. A couple of good questions on using the gym, or going to a gym as opposed to exercising at home. And I'm looking, and we just hit the 15-minute mark. So if you've been sitting, watching me, feel free to stand, give yourself a little stretch. And yeah, sitting for too long is not good for our spines either. Okay, my husband's laughing at me because this is me all the time. Okay, sorry. Which is better for building bone density? Free weights, like squats and lunges, or resistive machines? So I do have a YouTube video just on this, but I do want to say that whichever is going to make you exercise more, that is probably where I would encourage you, what I would encourage you to use. However, if you are strong enough to use free weights, that is going to be more functional and strengthen more of your spinal muscles and all the other stabilizers. Okay. Which gym exercises is best for strengthening your spine and your hips? For the hip, it's the leg press, but be cautious not to allow the machine to go too far forward into a deep squat. You don't want to lose the little arch in your back then you're technically going into lumbar flexion. And for the spine, it's actually the Roman chair, which a lot of you may or may not have been exposed to, where your feet are hooked into the back and then you lift up. If you look it up, you'll find it on YouTube. And to increase spine bone density, is it better to lift weights or to pull weights? So an example they gave was a lat pull down machine. So the overhead press done in standing, not sitting, is a better choice for building spine bone density, because you are loading the spine. So long as you don't have a compression fracture, you have good spinal alignment, I would not recommend that the overhead press be done if you're unable to actually get the arm in line with the shoulder. So if you're lifting here, that becomes more of an issue. So there's some body mechanic issues to take into consideration. Okay. Next, because that was more in the strength training exercise component, as I said, the next important part is weight bearing. So this one's on walking. Is walking outdoors on the pavement better than on the treadmill? And so there will be greater ground reaction forces, meaning when your foot hits the ground, there will be more pressure felt or forces sent up through your body when you're on the pavement. But again, with inclement weather all over the world, and right now in Canada, people are much safer to walk on the treadmill this time of year than on the pavement. So take those things into consideration when making your choices. Better that you walk on the treadmill than not walking at all. Does running or jogging in short bursts have the same positive effect on bone as jumping or hopping? So it is very similar, and again, you want things to be sustainable, and you want to enjoy doing these movements. So if you currently are doing your cardiovascular exercises and you want to include some short bursts of the jogging and the bounding, which is like kind of jumping side to side, all of those things are great. You're just looking for just different weight bearing through your hips, and that's super. Also, the cardiovascular component, very important. Continuing on the strength training, so back here, okay, somebody had said their doctor says there's no evidence that lifting weights can help. I would ignore them and or change doctors. Best exercise for osteoporosis if you have never fractured. Pretty much just the best exercise, I mean, whether you're fractured or not, you still want to have intelligent exercises. And so if you've never fractured, it's the exercises don't change that much. It's just what your current fitness level is and what your body can do well, and build from there. So it's such a, it's a really hard question to answer because I don't know what if you're 15 or 55 or 85, and yeah. The best arm exercise for osteoporosis. So I'm assuming you're looking for something to build the bones in your arms. And so anything that involves loading, which means, so crawling is great. Hands and knees, so the horse stance, as I call it in the book, other people know it as a bird dog. Those are great exercises for loading the forearms. Planks, side planks, especially done through the hands, push-ups, all of those are great ways to load the upper body. And, okay, balance. Oh, actually, sorry, one more that I think is important. What is a good alternative to using a barbell when doing squats? Since, yes, barbells are difficult to come by, and especially not recommended if you're working out without a spotter. You could certainly just use dumbbells, free weights, combination of free weights and weighted vests on your body. So those are all nice alternatives. Balance, as we mentioned, is a very important component. And so this question is, to support bone health, how long and how often does one need to practice various balance exercises? So if you have good strength in your legs and the weakness is truly just balance, then 2 to 3 minutes a day is usually plenty. You want to, however, always incrementally challenge yourself by changing the exercises you do, because that's the thing about balance is, you know, the surprise element. And so you want to just keep progressing through. I have lots of suggestions in my book and a video that's several hours long, actually, just on progression of balance from prehab all the way through to elite levels. So I know you'll all find something for yourselves. Okay, rowing is the next question, and using a rowing machine. And I know they're telling me all the good things about it in terms of pushing the weight through the legs and those kinds of things. But when you think about using a rowing machine, you are doing this not 8 times or 10 times, but usually hundreds of times. So any exercise that you're doing repeatedly hundreds of times with the resistance, or even more than 20 times, that is now an endurance exercise and not a strength building exercise. So for your bones, you're specifically looking for a strength exercise. So if you're doing something where you're wanting to pull, do a row, you want it to be hard enough that by the 8th to 10th repetition, you're like, that was hard. You wait a few minutes, do another exercise, do some balance, go back to it, and then challenge again. But that repeated rowing is not going to help your bones. And many, many people will end up in a kyphotic posture as well. What is the technique for jumping and landing safely? So I want to say that, when would you not recommend jumping? Okay, so I'll just bring those two together. I would not recommend jumping if you've had a vertebral compression fracture. If you're kyphotic, meaning your posture is such that your head is in front of your shoulders, and your spinal alignment is not very good. If you are unable to do a squat with weight, with good form, you should not be jumping, because landing a jump requires your legs to take the extra weight of your body through gravity. And if you can't do it without just the actual landing component, you're not going to be doing your knees any favor, and with time you'll have to give up a lot of things. If you have foot issues, if you have poor balance, if you have a pelvic floor prolapse, if you have incontinence, any of these things I would not recommend jumping for. And the proper technique is where you actually, land with your feet usually hip width apart, where your knees end up pointing, where your toes are pointing. And so, yeah, those are, hopefully, you'll see examples on the website. And the next category in terms of exercise is challenges. So challenges such as having osteoarthritis, spondylolisthesis, and I do have a lot of exercises up there on my website in terms of, especially for knees, and our YouTube videos. I have 3 different workouts for knees. So if you're having a hard time with lunges or squats, I encourage you to look at those videos and build up your knee strength, because the knee strength is really critical to protecting the knee joint. And there was a question in regards to spondylolisthesis, when one vertebrae slips forward from the other, and can you still do the same exercises? I'd say no, because if you have spondylolisthesis, your body will not like a lot of the hyperextension. So it's really important that you modify, and when you're doing extension exercises, that you just kind of find your neutral. Lots of other questions about arthritis of the wrists, of the thumb joint, and I would say to either see a hand therapist, a physical therapist, to get the right bracing and recommendations. Somebody asked about using bands. I do show you how to wrap bands properly in my book so that you're not having to engage the thumb. And I always find this when my clients tell me, I'm having hip replacements. So this individual appears that they've had both hips replaced. Does that increase the risk of getting osteoporosis? And I tell them, no, actually, they can't get osteoporosis of the femoral neck anymore, which is the most common fracture site. So at least those are 2 areas, both hips, that they don't have to worry about fracturing if they have hip replacements. So that's always very good. And one last one was in this category, getting on and off the floor. And again, I do have a great video on that, so please just do the search, Amelia Guide, and getting on and off the floor. Okay, so in regards to the LIFTMOR study, I have been hesitating to say very much publicly on this, but there have been many questions coming in, so I do have reservations about the LIFTMOR study, not the study itself, but I have significant concerns when I hear about so many people following this protocol, especially with some of the supervision they tell me they have, or they're doing it independently. So let me explain. So first, the people who participated in the study were very carefully screened. In fact, I believe only 75% of the people who applied, so there's about 400 that applied, 300 of them were filtered out for a host of reasons, rightfully so, for entering a protocol that it demands so much. So as a result, unless you work with someone who provides a similar screening process and doesn't just go, oh, you want to do this? Yeah, go ahead. I think if they're not screening out candidates, you should probably not follow this protocol. I mean, just because that individual is not following protocol. Second, there have been cases where individuals who have followed LIFTMOR protocol experience a vertebral compression fracture. And this is not talked about very much, but one of the cases was a participant in the very original study in 2018. And her compression occurred within a month or a month after the reporting period. And it was never documented, or nor was it reported on, because it was outside the reporting period. So generally in a study, if there's any side effects, you have a time period to record it in. So another case is an individual who kindly reached out to us. I'm sure there's many other cases out there, but she didn't actually leave a question, but I'm assuming she wanted me to share her LIFTMOR experience. So she wrote, excuse me. I was sent to a physical therapy specialist for osteoporosis, and she had me doing LIFTMOR program, which after only 3 visits gave me a compressed spine and fractured my first lumbar vertebrae. So now I'm fearful after 5 months of rest with pain and inflammation. So these are my concerns, yeah. And thirdly, if you don't have a strong background in lifting and you your body awareness and isn't there, and you haven't built up a strong foundation, I don't think it's a wise thing to follow the LIFTMOR protocol. You can protect your bones without doing heavy squats and deadlifts. And I thought I would reach out to somebody who world-renowned for his expertise in back care, and that's Dr. Stuart McGill, who's the author of several books on low back pain and rehabilitation. And he studied the effects of heavy squats and deadlifts on very high-level athletes around the world. And even in that population where they have executed under guidance and professionally, if they even just slipped out of alignment, he would, and it was written in one of his books, and he did share it with me, that he could hear a pop, and that pop was the end plate fracturing and the pain. So if that can happen with a very high elite athlete, then I'm very concerned that individuals who, even in a group of 8, you don't have a one-on-one trainer on you all the time. I think as he said, that the risk outweigh the gains or the benefit of doing the exercise. Which is going to take me into the next category that individuals had so many questions on, which is compression fractures. So what are the do's and don'ts of vertebral compression fractures? So I'm assuming that this individual has not seen the course that I worked so hard on, and we have a wonderful course, and it is called Living with Vertebral Compression Fractures. So I highly encourage you, if you do have a compression fracture and you don't know the do's and don'ts, that you protect yourself and look at this course. If for any reason, if any of you feel you cannot afford the course, it's under $100 and will save you thousands and thousands of dollars of therapy. But if you don't feel you can afford it, please reach out and we will accommodate you in some way. How long will healing take? That is very dependent on your physical health. We all heal at different rates, whether you have diabetes, your age, and so it's best to ensure that you are told by your practitioner that you have healed and that you can resume exercise. What specific stretches and strength exercises should you do following a vertebral compression fracture is very dependent on what your physical state was before you had your vertebral fracture. So there are many exercises that a therapist can choose from, and it's really critical that you have guidance through this. But if you do have my book, Exercise for Better Bones, I can safely say that the postural exercises, the balance exercises, beginner level, the flexibility exercises, and the beginner strength exercises are all safe to do, whether or not you're strong enough to do them or they need to be modified further. I am unable to, share that. I don't know if that's the case for you, or if they're too easy because you're really fit and you fell over your handlebars and you fractured one vertebrae. They might be too easy. So that on different ends of the spectrum, best to get guidance from a physical therapist. Is wearing a back brace helpful? Individuals are often recommended back braces. And I will be doing a feature shortly in the next month or so on the Spinal Med, which is a back brace that has been recognized to both build the strength in the spinal muscles as well as keeping you safe when you do have compression fractures. So the one thing, however, with back braces is with time, you do want to wean yourself from the more rigid back braces, and that's really important so that you do strengthen your back muscles. Excuse me. Okay. Best type of chair when you have a compression fracture. So when I see that, I kind of go, I'd actually like you to be lying more than sitting when you need a break. So often individuals will say, oh, but my back's so tired, or the pain's increasing, and that's when you need to lie down. Even if you could take a 10-minute break on your back where you're decompressing your spine, it can make a huge, huge difference. So that's one thing in regards to sitting, because sitting onto itself is quite compressive, more so than walking or standing. But if you are looking to sit, then you do want to find a chair that is supporting you as best as possible through your back. And if it doesn't have appropriate armrests, to be able to take the weight of your arms, through cushions or sometimes just body pillows that you can put underneath you, because sometimes just getting the weight of your arms off of your back is really helpful as well when sitting. This person is a competitive pickleball player with a thoracic, meaning mid-back, compression fracture, and how to keep playing safely. So be it pickleball or just activities of daily living, having strong paraspinal muscles. So the muscles that go along your spine, the deep spinal muscles that are going to allow you to, when you're playing pickleball or picking up something in your house or, attending to grandchildren, that they're going to allow you to do that with good spinal alignment. And if you have weak spinal muscles, that means when you're, playing pickleball or doing these activities of daily living, you'll end up being forward over and over again, which is going to put more stress on the vertebrae that are above and below the fractures. And unfortunately, that leads to more compression fractures. I would encourage this individual who plays pickleball, she's so young, she's only in her 50s, to reconsider the sport that she loves, so that she could spend more time engaged in activities or movements that support her spine, so she can have a longer life, I guess, without compression fractures, because one compression fracture leads to more very often. And some of you have compression fractures and don't know it, because many are, at least 50% of them are often occur without pain, or you might have had pain for a few weeks. But sometimes, this individual says, I still have pain 18 months after my vertebral fracture. Will I always have it? And sometimes individuals do have chronic pain with vertebral compression fractures, but I highly encourage you to seek the help of a trained physical therapist who can try different techniques. Also, massage therapists who understand the restrictions for vertebral compression fractures, because sometimes the pain is just due to the soft tissue or the muscles around the fracture site and not always the compression itself. And is it safe to, or are there exercises to do if you have vertebral compression fractures and osteoarthritis? Almost every single individual with vertebral compression fractures, not all, but most are over the age of 50, and most of us over the age of 50 have arthritis. So doing strengthening exercises and safe stretching is actually great for both. Okay. There's been a bit of chatter and questions out there about the VIBMOR study. The VIBMOR study, vibration and lifting, and there was a comparison, and this study was done now going on 3 years ago. The study data has not yet been released. So I'm always surprised when I hear chatter about it, and actually a little shocked that one of the study authors would say anything about having the data public, without actually having the data public. So for those of us who are still waiting, I'm going to share with you what one of our followers sent in by email. And she was actually quite concerned when she heard the negative chatter coming out of the study results. So she said, here, I've been using Marodyne twice daily for exactly 2 years. Now, even after the very discouraging VIBMOR results. Also, she does weights 4 times a week, God bless her. She has her prunes, she eats greens, she has her vitamin D and K. So a testament to you can't just do one thing. And here are my DEXA results, 2.5 years after my osteoporosis diagnosis. Her spine scores, she said increased 3.5%. And so it went from -2.8 to -2.2. And her femoral neck score, which is in the femur, went from -2.9 to -2.7. She said maybe VIBMOR's 1 time a day, 5 times a week wasn't enough. And she goes, I almost quit after hearing those results. So she is correct, and I was feeling the same thing, like, oh, why did they only do it once a day? Because we do know that using it twice a day, you will get better results. So it was very encouraging for her to send that in. And I'm going to go right into actually the next topic, which is the use of the Marodyne, because we've had so many questions. How are we doing? Okay. How proven is the vibration platform for osteoporosis? So please just put in into the Miller Guide website. There's a 3-hour interview with Dr. Clinton, and there's so much to share that I encourage you to listen through that. Is it still considered a good addition to treating osteoporosis, balance, and muscle strengthening? Yes, it is. Actually, since that interview with Dr. Clinton, there was another study that was done using low-intensity vibration. And I was really excited because it never made sense to me how the vibration platform could improve balance. But this study showed that the neuromuscular junction, meaning where the nerve connects to the muscle, well, we tend to lose that as we age, like we lose so many things. But by using the vibration platform, the nerve muscle connectivity was preserved. So that made sense that the low intensity vibration would also enhance balance. So yes, very important when looking at a program for protecting your bones. This individual says, the bone clinic at UCSF says the exposure to high intensity vibration can cause cancer. How about low intensity vibration? So they have done studies with children in cancer. It's been shown to be safe. There's a great interview that I did with Teresa Guys on her rodent study with mice on cancer, showed the LIV suppressing cancer's negative effect on bone. And there's currently a study underway with breast cancer individuals. But thus far, it's actually very safe and with very positive results. Another question in regards to cancer, and so in regards to aromatase inhibitors, and also the same would hold through if you are a man who is on testosterone deprivation therapy. Just like estrogen deprivation therapy, these things are very harmful to your bones. Unfortunately, your medical practitioner is trying to keep you alive and keep you safe, so they prioritize that. But yes, the low intensity vibration, based on the current studies we have, is a great option for you. Great comments from Dr. Guy's interview, so I encourage you to, again, just look up that link and on cancer or aromatase inhibitors on Milieu Guide. One of my clients kindly suggested that I tell you what I told her, what she said, yeah, that, and this is one of the studies that said that results when using a low intensity vibration can only be measured after 700 hours, and that you should and could use it safely 2 to 3 times a day. But the Marodyne website keeps saying just 10 minutes a day, so you can ignore their guidelines and know that that's sort of a very baseline, but you can use it more frequently. And there's some very good studies that were done with the low intensity vibration, and the best outcomes were individuals using it at least 100 minutes a week, or on average 20 minutes a day, 5 days a week. Okay. Then always questions about, can you use low intensity vibration with, if you have spondylolisthesis? Yes, you can. The person also asked if physical therapy can help for spondylolisthesis. Yes, it can in helping you strengthen your core safely. Can you use the low intensity vibration with bulging meniscus? Yes. With bladder prolapse? Excuse me. As far as we know, yes. With plates and screws that was for a broken ankle, even if it's 5 years old, yes. With osteoarthritis of the knee, yes. And actually many people with arthritis mention that their arthritis feels a lot better after being on the platform. With polymyalgia rheumatica, yes. However, if this individual says it's quite uncomfortable, not sure if I should persist, I would encourage you to just drop your time. Instead of doing 10 minutes, maybe standing for that long is too difficult, break it up to 2 5-minute sessions. Person's using it 3 times a day. Should I, feels really good. Should I keep it up? Yes. Can I do gentle neck stretches and shoulder stretches while on the Marodyne? Yes. And then there's a question about sacral nerve stimulation implant for incontinence. I reached out to Dr. Rubin, and he was not sure about that. And there was one other one that I had no idea. Somebody with 2 genes that makes him more susceptible, he or her more susceptible to tendon injuries and ruptures. And Dr. Rubin felt that that the low intensity vibration was safe for you, because of the recent study out of Hong Kong, literally just released less than a month ago, using low intensity vibration post hip fracture. And so the outcome for function had improved. And so you got the green light from Dr. Rubin to try the low intensity vibration. Okay, question about OSTEOSTRONG. Would I recommend it? No, in a nutshell. And there's a great video done on cautions and precautions of it. But basically, both myself and colleagues know individuals who sustain compression fractures at OsteoStrong or using OsteoStrong, and it'd be great if we all went, yeah, in 10 minutes you can get your bones better just like that. But no, you can't. Lastly, many sent out the other thing, yeah, with the OsteoStrong centers. A lot of them do have high intensity whole body vibration machines, which are known to be unsafe. And therefore, that's one other reason why you should not attend OsteoStrong. So just be cautious. Questions for petite individuals. The DEXA test can underestimate your bone density for women who are small and thin. Therefore, the DEXA test may indicate that you have low bone density when it's actually normal for your body size. So it's great if you are petite and you can get a baseline and then always compare your bone changes to what your baseline was, because that's you. And that's what I did when I was 42, and then tried to maintain and have thus far been able to maintain my bone density based on me. There were product questions. Do I have any? Okay, so I love your level 2 exercise tape, but I also want to do resistance training. So I think she might be doing my weight bearing. So I do have weight bearing. I think it's called weight bearing. And so there are weight bearing, such as aerobic training videos, and there are strength training videos where we actually use weights. But sometimes we actually use our body weight. This individual says they've completed the active level of the program and transitioning to athletic. They're looking ahead a bit. Don't see anything with the deadlift. Now you know why. Okay. Your video series on strength training ends with stronger bones, stronger body, active athletic. That's true. And will I be offering Athletic 1? That is my goal this year. Yes, one of many. With the athletic active level, they mentioned there's weights in day 1 and day 3, physical weights, and day 2 doesn't have physical weights. Can they switch the order? Yes, it's fine to switch the order. Just keep the, if you're doing day 1, day 3, day 2, there's always just keep it day 1, day 3, day 2, so that your body gets that recovery time in between. And does my book, Exercise for Better Bones, have exercises for individuals with spinal fractures? So long as those fractures have healed, yes, and just abide by what I had mentioned earlier under the compression fractures in terms of the segments to start with. I use your videos to exercise and wanted to ask what's the best way to start again when an illness or injury keeps you from exercising. Great question. Thank you for asking that one. So just start out with following the video, start the warm-up and the balance. That's where the video always starts. If that's all you do the first time, perfect. And then when we get into the strength component, then just start with 5 repetitions and then 7 repetitions. And then if you could do the first set, great. And then just very gradually build. So just taking it one day at a time and one step at a time is your best approach. Okay, so many questions. There's so many questions on pharmaceuticals, but I do want, there's, people asking okay, 72-year-old woman with a -3 DEXA, can I build bone to a -1 without medication? No, and you can't build bone with medication either to a -1. That's unrealistic. Individuals who are being told that they are going to build bone and get really great scores, if your program or the program involves supplements such as strontium and high levels of strontium, which is part of an AlgaCal routine as well, the strontium, just know that it is going to skew your bone density test results. So it is not that your bones are stronger, it's not that you have a less of a chance of fracturing, it just means that we now cannot properly calculate your bone density test results. So be cautious. And why do doctors push these injection drugs as the only way to build backbone? Is because for so long it was all oral medication and people just didn't want to take them. They didn't feel good taking them. And so pharmaceuticals companies did come up with injectables, which does obviously help with compliance. And can being on a bisphosphonate cause brittle bones? Yes, it can if you're on it too long. And so please ensure if you've been on a bisphosphonate for more than 3 years that you have a conversation with your physician. It is not recommended normally these days that you're on it for long periods of time. They will give you a break from it, or what they call a drug holiday. Okay, so not just going through now the questions, looking, what can I best address with the time left, but so many questions still coming in. I just want to thank you so much for trusting me with your bone health. And we are more settled in Portugal, and my husband is cancer-free, and therefore we do promise to do more live streams this year. And so questions that have not been addressed, we will most likely make them, its own live stream, or at least bring them into the spotlight for the live streams. Again, thank you so much. I respect your time. I don't want to go over, and I just really appreciate you taking the time out of your day to be with me. So take good care of yourselves and keep up the good work.